Okay, in this task it's about the heart, and there's a disorder where the aortic valve, the semilunar valve, doesn't close properly. So some blood flows back into the ventricle from the aorta. Ultimately that would mean that less oxygenated blood gets transported around the body, so it could be less aerobic respiration. So that could be an application question. It didn't in this, but it could have been an application question. Some things that we can pick up that are also important before we carry on. So you can see it's 19 patients, so that's not representative, it's a very small sample size. And also the word isotonic is a key word, so we know that this is the same water potential. And it links on the idea that there's no osmosis, so there'd be no osmotic damage, there'd be no bursting or shrivelling. So that must be the valves, to protect the valves, to stop water moving into the valves and damaging them, or water moving out of them and shrivelling them up so that they can function. We then looked at before and after surgery, so the maximum and minimum pressure in the arteries, and this is the normal pressures here which we can refer to. You can clearly see before surgery that this is higher than the top of the maximum that we would want, and before surgery this is below the minimum that we would want. So question 1 was a practical skills question. Why isotonic? Was used right in the investigation. So it's just as we said before, it's going to prevent osmosis, so water not going to move in or out of the valve, so it prevents the valve from bursting or shrivelling. So it can be used. Question 2, what conclusions can be taken from table 1? So if we look before and after surgery, so we've got a significant difference in the mean minimum pressures because the standard deviations do not overlap. And we've got an overlap in standard deviations for the maximum pressure, so there is no significant difference for the maximum pressure. If you're not sure how to find out if there's a significant difference or not, so here is the higher mean. We're going to minus the standard deviation, it gives us 18.2. Here's the lower mean, we're going to add the standard deviation, it gives us 20.4. So now this number is higher than that number, so that shows that there is an overlap. For next question, if we then compare it to table 2, has the surgery worked? Has it been effective enough? So we can see that some people's maximums are still too high. So the maximum upper limit is 18.5. So if we look after surgery, 18.2, so yes, the mean is lower than the maximum. But if we add the standard deviation onto that, 20.4, that's showing that quite a few people's maximum is still above the recommended range of pressures. And a similar thing can be seen about the minimum. So after surgery, if you add 1.1 onto 11, so it gives you 12.1, that's then higher than the normal range of values here. So again, some people is too high. So using this information, next question, there was sufficient evidence for the surgeon to continue using this treatment. Does the information support this? So first of all, let's go for the 4 points. So for the maximum, we can see that yes, it has decreased the mean, and the mean is within the normal range. That's a yes point. You can also see that the mean minimum has increased, and the mean minimum has increased within the normal range. So that's another 4 point. But we can also see that the standard deviations for the minimum pressure, there is no overlap. So that is an agree point as well. So we've significantly improved the mean minimum pressure. And also it includes a wide range of patients, so it's representative of age as well. So that's another 4 point. So all those 4 points would show that the surgeon can use this. The next question is, how does the information not support his conclusion? So rather than one big question that might be worth 5 marks, it's been split into a 3 and a 2. So question 5, how does this information not support the conclusion? So we can see that from the standard deviations, similar to what we said for question 3, that some of the patients will be outside the normal range of pressures. So some of these are too high, and some of these are too high when compared with the normal values. Also, only 19 patients are used, so it's a small sample size, so it's not representative. Another thing that wasn't done particularly well, it's a very short follow-up time. So 7 months was the mean, plus or minus 5, so quite a few were taken 2 months after surgery. So we don't know the long-term effects. If you go for this type of surgery, surely you would want to know what the long-term effects of this type of treatment would be. You don't want to have to go into hospital again in a year's time to have another operation. So we don't know any long-term effects because the follow-up time was very short. And also we've got no comparison with other treatments, so we don't know if this is any better than any other treatments or the current treatment. So the last question, using this table, why is it not possible to determine the highest pressure measured? And if we look, these are standard deviations. It doesn't tell us the range. So what this tells us is, for this number for example, that here's the mean, and 68% of the people are within 3.5 of that mean value, above and below. But it doesn't tell us the highest person, the highest heart, so the highest pressure in the artery is this, and the lowest pressure in the artery is that. Standard deviation can't tell us that.